I think the idea here is for people who were kind of moderating the panels to talk about what did we learn in our panels, and probably what are the implications beyond that. And we each have a maximum of 5 minutes to do that. So off we go. And I got to moderate the panel, so I get to go first. One of the first things that I heard from all the panelists on our panel was the importance of having strong organizational and state ownership, local and state ownership and capacity for the things that we're talking about. Over and over again, people said it's not just my program, it is creating the organizational capacity, the desire, the infrastructure necessary for this to happen. And it is a need of each of these evidence-based programs, but as Brian has pointed out to us this morning, it is a larger need that the field has that we have to really think about, which is how do we create the capacity for these kinds of things to be done in these different settings that we have been talking about. A second thing that I think I heard in ours was the importance of monitoring of implementation of the fundamental elements of the intervention, but in a much more realistic way, so that we can know where we are, kind of what Joe is talking about in terms of know where we are in the process of installation, and at the same time not so concerned with the tight rigor of I didn't do it quite right, that we're dotting I's and crossing T's instead of really thinking about are we getting in place what is necessary to make this change in outcomes for young people's cognitive, affective, and behavioral health. So a couple of things there. One of the things that I really resonated to that Lauren mentioned about, that I heard in Ron's talk, and that I don't think enough of us are focusing on, is creating demand, creating the interest in the world for what it is that we have to offer. Part of that is what Joe was talking about before. People don't respond just to the data, they respond to the stories. And I think we don't often work with creating enough of the stories that people can say, of course I want that in my community, of course I want that for my family, of course I want that in my pediatric practice, I want that for all my patients, etc. And for people themselves to say, I want this, where can I get this service? So focusing on pull, on creating demand, I think is something that we need to be thinking much more about, those of us who have been doing these kinds of trials. The next point was already raised in just this last session, but it's we have to be more complete and honest and forthcoming about how we deal with failure. How we talk about what didn't work that we tried and what we can learn and need to learn from that. And we have to think about that in our forums as well, because our format encourages all of us to put up PowerPoint slides that show our successes rather than help us all learn what there is to be learned. There is another thing that I think is really a tension that we've really got to struggle with, is this tension between the need for replication before we can feel confident about spreading things, and the fact that our trials really have internal validity but not very much external validity, and how we deal with this issue of the need for replication and at the same time the need to recognize that the things that we're trying to do need to be able to work in a variety of settings and contexts and be able to be adapted as necessary to be successful and effective in those contexts. And the last thing, this is just because I know I'm probably taking already too much time. The last thing from our panel I thought was just so fundamental is the importance of the organizational context in which these are happening, of the inclusion of the people who are going to be supervising everyday workers and everyday agencies to do these kinds of practices, the importance that those people are completely integrated into the system and understand the system and know how to do that supervision. That we often train the providers and maybe a little training for the supervisors, but we don't ensure that the organization has the understanding and the skills to integrate it fully into the work of the organization that we're expecting, hoping to do this work. So I'll just summarize those things as our panel.